In terms of how we're going to make greatest progress in the National Health Service over the coming year, I'm convinced that there's no one answer, not even one or two answers. The answer is that there is going to have to be a multiple set of approaches that we use to try to get where we need to in terms of improving quality and achieving efficiency. And this means a combination of top-down policy initiatives and probably more like a large set of bottom-up initiatives. So the best opportunities that the NHS can take, I think, are several. The first one is that we know that a lot of good quality care could be achieved in areas where patients have chronic disease and older patients with multiple conditions. And in particular, we know that a lot of patients fall through the gaps. They go to A&E and they go to general practice care and they go to hospital, they are treated in social services. But actually, a lot of that care is not very well coordinated, can lead to duplication, ill health, avoidable cost. So I think the NHS can and will be making big strides ahead to try to integrate care more fully, coordinate care, so that the health of these individuals who are most vulnerable will be better and thus avert the need for downstream costs. The other is on service reconfiguration. Clearly there are a lot of hospitals in England and across the UK. The question is, are they all operating both in the way that maximises quality and indeed are most efficient? Another big cause for hope is really the fact that the NHS has a massive amount of data which it does not use effectively as it could do in order to seek where there may be better quality care offered and indeed better efficiency. So I think we will see more and more efforts to, for example, link up data records in individuals in order to predict more carefully and target them for support and to work with the patients and to effectively be more person-centred. And indeed to improve the flow of care across different multiple settings can be helped with this approach. What I would really hope to happen is that all the information we have on quality of healthcare looks as if it's going in the right direction. In particular, with respect to people having chronic disease and older people with multiple frailties. If we could make some progress on the quality of care for them, I think that would be a fantastic year. And secondly, the obvious point is to hope that fewer providers in particular, and indeed commissioners, go into the red over this year, that actually they do manage to live within their means through various effective measures, not cuts necessarily, but efficiencies that still protect care for patients, and that they will be able to make those efficiency savings that are needed for us to live within our means. That would be a fantastic year for the National Health Service.